I'm David Navarro. Welcome to Tiempo. Joe Torres is off. Money, always a hot topic, and the way to financial stability is knowing how to better manage your budget. We're going to talk to some people who run workshops aimed specifically at helping Latinos improve their financial situation. But first, a very important topic, your health. The flu season has begun, and although it's not in full swing, it's very important to get a jump start and get your flu shot now. Flu, terrible illness that can keep you in bed for up to 2 weeks, and it can also be deadly. And studies show Latinos are less likely to get the flu shot than non-Hispanic whites. But this year, there's real protection in some new products. Dr. Jay Adlersberg here with the latest on the improvements to the flu vaccine.
Nice weather doesn't bring the flu to mind, but even pharmacies are touting the flu shot. Flu season begins in November.
It takes about 2 weeks to develop some immunity, and so now is the right time to go to your physician and get vaccinated.
The message is out. This is flu season. I just wondered if you're planning to get a flu shot.
Absolutely.
I'm going to get the flu vaccine because I don't want to get the flu.
And now there's an improvement in the vaccine shot. The big news is that this year's vaccine will protect you against 4 flu viruses rather than the standard 3. Here's the new shot against 4 strains of the flu virus.
I went to my CVS pharmacy and they said they're not going to use that. They have the 3 strain.
Not everyone has the 4-strain vaccine yet. It's new this year. There's a chance it won't work any better than the 3-strain shot. Then there's the nasal spray vaccine for kids and adults up to age 49. Dr. Peter Polisi helped decide on the makeup of the vaccines at the FDA.
When given to children 2 years and older, is protecting very much, and that is a real advantage in a family, in a school situation.
Most flu vaccines are made in eggs, but now there's a new one that's not for people with egg allergies. For seniors with weaker immune systems, there's a double dose shot to increase their chances of being protected. For pregnant women, excellent news on protection. Those who get the shot are 30% more likely to reach week 32 before giving birth. Also,
the percentage of stillbirth goes down by 30% in women who received the influenza virus vaccine versus those who have not.
This is Dr. Jay Adlersberg, Channel 7 Eyewitness News.
All right, so let's talk flu shots. We're joined now by Dr. Guido Macchiavello, an internist at St. Barnabas Hospital Ambulatory Care Center, and Dr. Franco Diaz, a general practitioner with Hackensack University Medical Center. And we thank you both for making time for us.
Thank you.
Guido, just so why are Latinos disproportionately not getting the shot, if you can give us a guess, versus whites?
Well, I think it's very multifactorial. One of them is the lack of having confidence over what their medical system can offer for them. They're not going to, they feel that some of them, because they're lacking insurance or lack coverage, they're not approaching their primary care providers. Another thing is that they're still thinking that they might not get the full benefit from it, and that they might get sick from it.
Oh, isn't that possible?
Well, every vaccine gives you a reaction because the intention is to actually create your immune system to boost a reaction against an organism. So it will create not like a side effect, but as an expected effect. That can create some symptoms, such as like a mild fever and some mild symptoms of discomfort. But I think the benefits from actually being vaccinated is completely outweighed by the, just risk of getting mild symptoms.
Dr. Diaz, why don't you talk a little bit about that? Who's really at risk with the flu?
Well, most people are at risk are the elderly, excuse me, the people with pulmonary diseases, young people with asthma, people with diabetes, heart disease, any other chronic illnesses that probably will cause significant amount of complication once you get the flu. The major complications of the flu is always the pneumonia, with the superimposed bacterial infection with the staph, which can be fatal. Other symptoms and syndrome that is very well known is the Reye syndrome in children, where you have a flu, and they tend to give aspirin to children. This is something that should be emphasized, not to use aspirin when a child less than 15 years of age has the flu, because it's a risk involved that they may develop Reye syndrome, which carry 50% mortality. Other factors are why the Latino may not use the flu vaccine or take the advantage of them, maybe economics.
Yeah.
The usually vaccine are costing about $15, $20, $25 in some centers,
Right.
and that may be also a problem. However, we're beginning to see more and more employers utilizing the flu vaccine and giving to the employees, particularly in restaurants and other places where it's really needed, where we have a group of Latino with a very low income, and that also is becoming to be quite favorable.
Right.
You know, acquiring immunity against the flu.
I think right off the bat, you're going to think that access to medical care is going to be an issue for why a community may not be or be getting it better than the other. How about language? How much does language play in terms of why Latinos are not getting their shots like everybody else?
In general, we are becoming better and offering not only Spanish-speaking doctors, but we also have translation services that they're becoming better and better every single semester, I would say, and how the patients can be approached on getting the right information in their own language. So I think we're targeting that as well. Nowadays, all the information is available in Spanish as well.
Right.
So I think we're also being conscient about targeting that to our Spanish-speaking population.
I have some more questions I want to get to with you guys. We're going to take a short break. When we come back, why you need the flu shot this season, especially since it offers more protection than ever before. Welcome back, everyone. On Tiempo today, we're talking about the importance of getting the flu shot, especially since many Latinos tend to skip getting inoculated. We're joined by Dr. Guido Macchiavello, an internist at St. Barnabas Hospital and Ambulatory Care Center, and also the clinic site director, and Dr. Franco Diaz, general practitioner with Hackensack University Medical Center. And Dr. Diaz, let me go to you. You know, we were also talking now in the break that one of the big issues in the Latino community is travel. I mean, so much of us spend family at different places that are coming here and we're going to them. Tell us a little bit about how that bears into the whole issue over getting your flu shots.
Well, I think that is important because one of the major form of transmission of this flu is through air droplets, and we have patients commuting constantly in an airplane coming from the Caribbean places and from South America, and they acquire the virus there, they travel, they come in the plane and cough or sneeze, and the thing begins to spread even worse. So one of the things that we could do is to have the Hispanic community to be notified that if they're going to have visitors coming within the time of the flu season, that perhaps they be able to get the flu vaccine back home, and perhaps when they come into the country, they already have that immunity.
Right.
Many of them also come without insurance. They get sick, they get pneumonia, and it's a major burden for hospital to bring this patient into the...
It's really something you have to keep on your mind when you're having family and relatives. And Guido, we were talking about another thing that is unique, I think, in many ways of our community, is the multi-generational issues that happen in the family. You got grandmas, you got young ones, you got 3 generations in many homes.
That is correct. And so we were having the conversation is that some of our patients, we can see that they're young adults. They don't realize that they're pose a risk to both their children and their parents that they're communing with in the same household. They don't recognize themselves as they can be the link of transmission to these two sensitive ages of very young children and elderly people. And therefore they don't get vaccinated. And they should recognize that, as a matter of fact, they are a good source of targeted prevention. And they should be offered and be educated about getting themselves the vaccine as well, just because they pose a threat for their loved ones to get sick.
Right.
And actually they could have more fatal consequences than the young adults.
Hopefully we've raised some awareness in this discussion. You know, we have this website that we're putting out called flushot.healthmap.org. It tells you locations. You can obviously find out some more about getting flu shots. And if nothing else, guys, what do you want to tell everybody?
Well, get the flu shot.
Get the flu shot
today.
Are you not listening to us?
Yes.
Thank you both again for
Thank you
joining
very
us
much
today.
for having me.